Hi, I'm Laura Tragonic, and I'm a licensed physician and a scientist and the host of Translating the Science, where I will break down a recently published paper or presentation on trans issues in a non-ideological manner in about 5 minutes. This week, I'm going to be talking about a paper called Sexual Satisfaction and Dysfunction in Transgender Adults Following Puberty Suppression Treatment During Adolescence by Dr. Meulens at the University of Amsterdam Medical Center, which was published in the Journal of Sexual Medicine this past month. Now, why is this paper important? Puberty blockers are often used as part of medical gender-affirming care in trans youth in order to prevent or to pause the normal development of undesired secondary sex characteristics during puberty, like breast and hip growth in trans boys and deepening of the voice in a more masculine physique in trans girls. Puberty is thought to play a major role in genital growth and in normal sexual development, including that of desire, arousal, and the ability to achieve orgasm. Pausing or preventing puberty thus may theoretically lead to higher rates of sexual dysfunction as adults, particularly if they are given at an earlier stage of puberty when sexual maturation is incomplete. These concerns about aberrant sexual function in adults are among the many rationalizations provided for restricting access to puberty blockers in the UK CAS report and in the US HHS report, despite there being little in the way of hard data to show whether giving puberty blockers in trans youth actually led to higher rates of sexual dysfunction or lower rates of sexual satisfaction. Conversely, if an undesired puberty is not blocked, then if these kids transition later, they may experience less sexual satisfaction due to having a negative body image resulting from the difficult to reverse effects of that undesired puberty. In short, we simply do not know the impact of puberty blockers on future sexual health, and thus this is the question that this study sought to address. This study was performed by surveying 70 transgender adults, 50 trans men, 20 trans women, who had all been started on puberty blockers as adolescents 9 or more years previously. 75 others were asked to participate, but chose not to. They on average started puberty blockers around age 14 and a half and stopped them at age 16 on average when starting cross-sex hormones. 66% were heterosexual, and 24% received puberty blockers in early puberty. 42% of trans men had a phalloplasty or clitoral enlargement, and 95% of trans women had a vaginoplasty. The two main outcomes measured were sexual satisfaction, how content individuals felt with their sex life, and sexual dysfunction, defined as a problem related to desire, arousal, or the ability to orgasm. Among trans men, 52% reported being satisfied with their sex life, and 58% experienced at least one type of sexual dysfunction, most commonly a difficulty in initiating sexual contact. Among trans women, 40% reported sexual satisfaction, 50% experienced sexual dysfunction, with 35% specifically reporting an inability to achieve orgasm, all of whom, incidentally, were in the group who started puberty blockers later in puberty. 28% of subjects reported having no sexual activity in the last year, which compared to 15 to 20% of similarly aged cisgender adults and 35 to 50% of trans people who started therapy as adults. Some subjects provided explanations for their sexual dissatisfaction, and many related this to difficulties in finding a partner, or because of the physical appearance of either their native or their surgically constructed genitalia. So what can we conclude, and what are we still not sure about? Overall, it did not appear that sexual satisfaction or dysfunction were meaningfully affected by the timing of blocking puberty, and that the rates of sexual satisfaction and partnered sexual activity were higher when compared to those of trans people who transitioned as adults, and is similar to what has been seen in cisgender adults. This study highlights that sexual satisfaction is not merely related to the ability to get aroused or to achieve orgasm, but also relates to a person's sense of desirability, and highlights that sexual health can be negatively impacted by letting an undesired puberty proceed. However, we must also keep in mind that survey research can be affected by numerous biases. More than half of the people asked to participate in the study chose not to complete the survey, and we don't know if their sexual health was better or worse than those that did. Also, there are relatively small numbers of trans girls, which made comparisons between the early onset and late onset of puberty blockade unreliable. Overall, I think this study provides reassurance that sexual satisfaction occurs in an appreciable number of trans adults with a history of puberty blocker exposure as children, and that the results obtained are comparable to what we see in cisgender young adults. And this also challenges the notion that providing these therapies in early puberty prevents normal sexual development. This study also reinforces the potential role that one's body image and one's sense of desirability has on one's satisfaction with their ability to function sexually as an adult. If you have any questions about this presentation, please leave them for me in the comments on YouTube or wherever you find us on social media. Thanks for joining me for this episode of Translating the Science. I'm Dr. Laura Tregonik. See you next time.